A young woman who visited the toilet often.
Have been visiting toilet 3 times in an hour. I don't want to sleep in the toilet.
Nandini is a happy-go-lucky girl who is studying at Management and Science University. However, one day she noticed herself in danger when she discovered blood in her non-stop diarrhea.
I've been experiencing abdominal pain, nausea and consistent vomiting, and I've lost 5 kgs just in a week. And it get worse when I saw blood in my diarrhea.
Without wasting any time, she decided to visit the hospital. Dr. Jessica, a gastroenterologist, did a full checkup on her.
Based on the clinical manifestation, the patient was likely to be infected by a parasite. Usually all these symptoms are related to intestine or any problem in the gastrointestinal tract. Most common infection usually resulting in bloody diarrhea, which is amoebiasis, caused by Entamoeba histolytica, giardiasis caused by Giardia lamblia, and balantidiasis caused by Balantidium coli.
The stool sample was sent to the laboratory for further investigation. The parasitologist Gayatri had done a direct wet mount test to identify the specific parasite.
The stool sample was obtained from the patient who was suffering from a parasitic infection, and as I observed under the microscope, the sample revealed Balantidium coli, trophozoite and also cyst. So this confirms that this patient is having balantidiasis.
A parasite inside me?
Upon hearing the shocking news, Dr. Jessica explained to the patient in full detail regarding the parasite Balantidium coli.
The histological features of balantidiasis are similar to those of amoebiasis, include flask-shaped ulcers separated by areas of normal mucosa. The ulcers are usually multiple and superficial, but ulcers are also seen in fulminating cases.
The bloody diarrhea is resulted from the ulceration in the large intestine due to the Balantidium coli. Balantidium coli has 2 developmental stages, a trophozoite stage and a cyst stage. Trophozoite stage is a growing stage in the life cycle of some sporozoan parasites when they are absorbing nutrients from the host, whereby cyst stage is a stage in the life cycle of certain parasites during which they are enveloped in a protective wall. The cyst is the infective stage of Balantidium coli life cycle. Once the cyst is ingested via feces-contaminated food or water, it passes through the host digestive system. The tough cyst wall allows the cyst to resist degradation in the acidic environment of the stomach and the basic environment of the small intestine until it reaches the large intestine. There, excistation takes place. Excistation produces a trophozoite from the cyst stage. The motile trophozoite then resides in the lumen of the large intestine, feeding on intestinal bacterial flora and intestinal nutrients. Trophozoites multiply by a sexual binary fission or sexual conjugation, which is the exchange of nuclear material. The trophozoite may become invasive and penetrate the mucosa of the large intestine, which result in the flask-shaped ulceration. Trophozoites are released with the feces and encyst to form new cysts. Encystation takes place in the rectum of the host as feces are dehydrated or soon after the feces have been excreted. Cysts in the environment are then too ready to infect another host.
There are two choices of treatment can be given to the patient. First, tetracycline for 10 days or metronidazole for 5 days.
Upon taking the antibiotic, the patient is now parasite-free. However, how did she obtain this parasite is seen to be unknown. She may be obtained it through the intake of contaminated water, contaminated food, or any other contact with soil or fertilizers or other sort of environment in which there is presence of pigs.